Hello, I'm Dr. David Hornbook, and a lot of you know me. I really have two roles in my dental life. One is I am a private practitioner in San Diego, California that has a very active restorative practice. Secondarily, I am the Clinical Director of Education and Technology at Keating Dental Arts in Irvine, California, where we do a lot of live patient and chair-side, basically restorative dentistry and aesthetic dentistry, teaching other dentists and really maximizing new technology. One of the technologies I'm very excited about, it's brand new on the market, and it's called the LiteTouch, and it's an erbium YAG laser. And this is made by AMD. AMD Lasers. And you can go to their website at amdlasers.com to see more information. AMD originally brought us the Picasso and the Picasso Lite, which are definitely the leading diode lasers on the market. Now, the cool thing about the LiteTouch being an erbium YAG, it is hard and soft tissue. So what do I mean by hard and soft tissue? Well, let's first talk about soft tissue. Soft tissue being gingivectomies, frenectomies, ovaponic, operculum removal, uncovering implants, because you can use it safely around implants, uncovering teeth to be orthodontically moved. We can do gingival retraction, where we actually make a trough instead of packing cord. So almost anything that we would use a diode for, we can use an erbium YAG. And the way the erbium YAG works, instead of using heat or attracted to dark pigmentation like a diode, it actually absorbs and explodes water molecules. So it's a very clean, heat-free, atraumatic cut, soft tissue. The second is hard tissue. Now, hard tissue being enamel, dentin, osseous, and lastly, removing existing restorations. So the erbium will not replace your dental handpiece. It's a little slow. It's not going to prep 10 veneers or a full crown, but certainly your class 5s, your class 1s, your class 3s, your class 2s, most of the time pain-free. We can actually cut the enamel, we change the setting, cut the dentin. If there's caries or close to exposure, you actually change the setting, and you can set it for a caries setting. Since it cuts by absorbing water molecules, we can actually make it very tissue specific, because each type of tissue, whether it be hard or soft, has different water concentrations. So we can use it to prepare teeth. It's great on pedo or kids where we can go in anesthetic free and remove these incipient lesions and provide very conservative, tooth-colored, pain-free restorations. The last is removal of existing restorations. The nice thing about this is you can remove existing all ceramic, not PFMs, all ceramic restorations, because the laser energy goes through the ceramic without damaging the ceramic and disrupts that bond between the dentin and enamel and the resin. Lots of times when I mean removing existing veneer, especially if they're lithium disilicate, which I go through a lot of diamonds to cut through, and those that have done that, you know exactly what I'm talking about. I can take the LiteTouch, go back and forth over the restoration. It works great for veneers. Usually takes about 60 seconds, maybe 90 seconds on a thicker restoration. If it's a crown, I have to go from the lingual as well. Back and forth, does nothing to the ceramic, disrupts the adhesive layer. I'm able in some situations to take an Explorer or a scaler, go underneath the margin, and the restoration actually comes out intact. Then if we're replacing it, we're just redefining the margins with a fine finishing diamond, no more removal of tooth structure. If it's a thicker restoration or it was bonded properly, lots of times it may not be able to be removed in one single piece, but when I pull on it, it'll break and it'll come off in multiple pieces. But then again, I'm not taking my diamond and having to grind all this lithium disilicate or even a lucite reinforced ceramic like Empress, which is also difficult to remove. I'm not taking multiple diamonds and a lot of time to remove this ceramic. So be sure to look at the LiteTouch soft and hard tissue laser. It's an affordable option. Typically, this category of erbium YAG has always been very expensive. AMD Laser has made it affordable, compact, easy to move from room to room. It's available with multiple tips, sizes, and angulations. Very user-friendly, and AMD, as always, has done unbelievable in their customer support and their video training.